Chronic multisymptom illness, or CMI, is a condition characterized by multiple, poorly understood symptoms that are not better accounted for by other behavioral or physical health conditions. The prevalence of CMI in veterans of modern wars is estimated to be between 25 and 50%, and it's higher among those service members who deployed to combat. My name is Drew Helmer. I'm an internist and a health services researcher at the Center for Innovations in Quality, Effectiveness, and Safety at the Michael E. DeBakey VA Medical Center in Houston, Texas.
Hello, my name is Major Rachel Robbins. I'm a rheumatologist and the Associate Program Director of the Rheumatology Fellowship at Walter Reed National Military Medical Center in Bethesda, Maryland.
So we're here today to talk about the article, The Management of Chronic Multisymptom Illness, synopsis of the 2021 U.S. Department of Veterans Affairs and U.S. Department of Defense Clinical Practice Guideline, published in the Mayo Clinic Proceedings.
There are multiple definitions for CMI, though common features of those definitions are that they have chronic symptoms from multiple body systems or domains, such as fatigue, mood or cognition disruptions, sleep disruptions, gastrointestinal problems, and pain. There's substantial overlap with other system-based conditions, including fibromyalgia, irritable bowel syndrome, and myalgic encephalomyelitis or chronic fatigue syndrome. There are relatively few clinical trials of treatments for CMI and fewer systematic reviews of evidence-based treatments. Thus, it was difficult for providers to effectively manage and treat patients with CMI. Therefore, the CMI working group included literature related to fibromyalgia, irritable bowel syndrome, and myalgic encephalitis, or chronic fatigue syndrome.
The multidisciplinary CMI Clinical Practice Guideline Working Group, of which both Major Robbins and I were members, used the GRADE methodology as required by the VA DoD Evidence-Based Practice Working Group. We examined the literature exploring 12 key questions related to chronic multisymptom illness and its treatment. Outcomes of interest focused on improving functional status and quality of life, as well as improvement in individual symptoms such as pain, fatigue, and cognition. The clinical practice guideline makes strong, weak, or no recommendations for or against particular interventions based on a review of the literature.
The working group categorized the recommendations into three main categories for treatments: behavioral health, complementary and integrative health, and pharmacologic interventions. We also grouped our recommendations in terms of general CMI, and then also CMI with symptoms consistent with fibromyalgia, irritable bowel syndrome, and chronic fatigue syndrome.
The clinical practice guideline also includes an algorithmic overview of the management of chronic multisymptom illness, which highlights the recommendations as well as some general recommendations for an overall approach to this condition. Some of the notable recommendations included in the clinical practice guideline that I would like to highlight are the use of cognitive behavioral therapy and mindfulness interventions, the practice of yoga, tai chi, or the use of acupuncture, and a number of evidence-supported medications, some of which are actually FDA approved for use in patients with chronic multisymptom illness and symptoms consistent with fibromyalgia or irritable bowel syndrome.
This update to the CMI clinical practice guideline identified a larger number of specific interventions for CMI compared to the 2014 clinical practice guidelines, indicating that there is growing evidence in this peer-reviewed clinical and scientific literature. The clinical practice working group did note several gaps in our knowledge, however, and we made several specific recommendations for future research. The CPG working group would like all clinicians to be aware of CMI and the evidence-based interventions they can bring to the management of patients with this condition. The CMI CPG and related tools can facilitate better knowledge and care for veterans, service members, and others.
We invite you to read the article summarizing this clinical practice guideline for chronic multisymptom illness in the May 2022 issue of the Mayo Clinic Proceedings. We hope that you find this helpful and that you're able to share this knowledge and this information with your colleagues to promote better care for our patients.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.